do you guys refer out? You know, at what point do you feel, I know it varies with patients. So what are some things that you guys look for to say, okay, this needs a higher level of care. It needs the residential or intensive outpatient, that kind of stuff.
For medical, um, it's pretty strict APA guidelines for criteria. There's certain numbers that you can hit. So those can be helpful. But then again, that only gets you so much in terms of like treatment. But like if you look for making, like you're checking like vital signs, like heart rates, you're tracking weights, lab work, if anything becomes like abnormal and the patient's motivation isn't high enough to do it outpatient, meaning that they won't comply to the meal plan, they won't comply to the exercising structure, stuff like that. I feel like that's when you kind of have to start thinking about a higher level where there's more monitoring and take some of that stress and control out of like the client's hands and puts it into somebody else.
Yeah, absolutely. Yeah, like definitely weight motivation. I actually often refer to like the APA guidelines for for eating disorder treatment. I like have it as a saved tab on my computer so I can go through and review. But one thing that like even now kind of increases my like fear with clients sometimes and for level of care is like the amount of purging that someone might be engaging in, because purging can just be so dangerous. So
This patients I was most scared to admit at like residential level were the ones that were purging outpatient, because you really have no control over what they're gonna do. Where anorexic is the one that they're so sick because they're so skinny. Like purging is so detrimental because you're losing all those electrolytes, and the electrolytes you need for your heart to function so you don't go into lethal arrhythmias. It's really like they can go downhill so quick, and it's really scary.